Interventional invasive cardiology is the subspecialty of cardiology that does invasive diagnostic testing using cardiac catheterization.
Interventional radiology is a subspecialization in radiology that uses image guidance to perform minimally invasive procedures.
We have a different perspective on a lot of things in terms of training, which just makes the experience even better.
My professional time here at CMC is roughly split between doing diagnostic radiology, that includes interpreting things like chest x-rays and CTs and ultrasounds, and then the other half of my time is spent doing endovascular interventional radiology, which is the minimally invasive procedures, oftentimes through either arteries or veins.
We do diagnostic angiography, which means using contrast to define blood vessels and where the narrowings are in them, whether legs or kidneys or arms, so forth.
Dr. Sodems and I do peripheral vascular disease. So the advantage to patients to be referred to us is first and foremost, what we do is we reestablish arterial flow for patients who have lower extremity claudication.
It's very easy to diagnose with what's called an ABI, an ankle brachial index, which is a test using a blood pressure cuff. Readily available, very cheap, no risk, not uncomfortable. This problem and treatment is still very underutilized, and yet it's available right here in Ithaca.
Another area of my practice here is kind of categorized as women's health. That largely includes doing uterine fibroid embolization. Alternatively, women's health also includes something called pelvic congestion syndrome, where we go in and correct veins that are flowing the wrong way.
Well, our office is open from 8 to 4:30 by appointment, and then we do all of our work in the hospital itself. But the outpatient practice part of the office setting is attached to the hospital.
Clinical integration works great for my practice. It minimizes the amount of time I might have to repeat pre-procedural testing for the purposes of planning. Most referring physicians and referring providers would not anticipate that a radiologist would actually have a traditional clinic, but I'm an interventional radiologist and we do very much so have a traditional clinic. I see patients in the clinic here at CMC every Thursday, and my procedure times are on Wednesday and Friday. I meet my patients, I talk to them, I follow them closely. So when patients are referred to my service, I do foster a very personal relationship with them, particularly if they undergo an intervention, and I have to subsequently manage their care after the procedure.